Hello, hello. Welcome back, everyone. Welcome back to the CT Tech Cheat Code 10 episode audio podcast. So, this is episode number 4, and we are just going to continue rolling into this just audio episode. So, in this episode, we're going to talk about contrast. Okay, so contrast media, which is super important when it comes to being a CT technologist. So basically, it'll make or break your career. All right, so let's get into this. So, contrast media will either make you a qualified tech or a liability. It's your choice. Okay, now some of the things, and I'm going to briefly touch on this, is that contrast media is one avenue that we can visualize structures in a CT scan. Okay, so when it comes to making sure that we know everything about contrast safety, timing, injection, and confidence is something we're going to talk about in this episode. So, when we talk about contrast safety, we're talking about making sure that we review patients' labs, creatinine, BUN, GFR, if those apply to your facility. Making sure that we review allergies to make sure patients are not allergic to contrast or anything that's related to contrast. If they have like a large amount of allergies, they could be susceptible to having a contrast reaction. I've seen that in the past. And making sure we have consent forms if that applies to your facility and applies to your state, because some states don't require consent forms. So that's what we talk about contrast safety. Now, when we as technologists are talking about timing, well, we're talking about, delay times from when you start your injection to when you start your scan. We're talking about bolus tracking, smart prep, sure start, whichever type of machine that you're using, which those are all mechanisms to do arterial exams. Or you have a fixed delay when you're doing a venous scan. So venous delay when we're doing abdomen and pelvis, which is usually between 60 to 75 seconds, depending on what your facility uses. Okay. Now, we're also going to talk about injection tips, and this is a big one. So, when we talk about contrast injections, we're talking about IV gauge. Now, typically in CT, we prefer an 18 to 20 anticubital line, and because contrast is very viscous, just think of injecting maple syrup and trying to hand push it with a freaking syringe. You're never going to get that in that vein and into the circulatory system as fast as you need it to be. That is why we use power injectors. And I can't stress enough to, nursing that this is a very important part. Okay. So those are the locations and the gauges that we need. Now, typically in CT, yes, we do use a 22 gauge if it's just an abdomen and pelvis or a head with contrast or a neck with contrast because patients got small veins. We can totally just utilize that because we don't have to inject at a very high volume and we can get through the exam no problem. Now, the thing is that we cannot use a 22 gauge for a high fast injection because that elevates and it raises your extravasation rates. And that is something that can be potentially harmful for the patient and they can fucking lose their arm. I've seen it happen. Okay. It can cause compartmental syndrome and patients can have a lot of tissue damage. I know a case many, many years ago where a tech just kept injecting contrast because the, IV was infiltrated and the patient had to get multiple skin grafts. So we have to be careful. That's why it can make or break your career because, contrast can be potentially dangerous and we have to make sure that we do it in a safe manner for our patients so they can get the testing that they need, get a diagnosis, and be able to get treated. Okay, so we also can use what we call a 22 gauge diffusix. Now, these are for patients that are super hard sticks. Diffusix are awesome where you can inject up to a 6 cc per second rate and you can inject contrast, get a nice PE study. They come in all sizes, the diffusix. They go from 18 all the way to a 24 gauge diffusix. I know in my facility we use the 24 gauge diffusix on babies when we do cardiacs on babies, and it works really well because we can power inject through that because we need to. Now, one thing that I do stress with all the technologists that I've ever trained is confidence. confidence, confidence, and explaining contrast to patients and just touching on the main points. Listen, we don't have to use a lot of medical mumbo jumbo when it comes to our patients. The only thing that we need to do is explain it to them in just terms that they can understand, or like I like to call dummy terms. Okay. So, confidence in explaining contrast to patients. Let them know what they're going to feel. Let them know when you're going to start the injection. Let them know what side effects they're going to have. Taste of metal. They're going to get hot. They're going to feel like they're wet in the pants. Sometimes patients experience, pain at the site because it's really thick and it will burn going into the vein. Sometimes patients will feel nausea and, will throw up because it will irritate the lining of the skin. So it's important to have confidence in making sure you touch those major points, because then patients build trust in you and they know exactly what to expect and they know that you're going to take care of them. So fake it until you make it. Have some fucking confidence and just do the damn thing. Okay. It is okay. Even if you're a beginner and you're starting out, you can still have confidence in knowing what you're talking about. Okay. So I want to see some confidence out there with you guys. Okay. Now, if you need extra help and you need to be walked through everything that they didn't teach you in your training, in a CT program, or whatever the case is, I have a contrast course that I am building. Okay. And it's going to be inside inside my portal of courses. Sorry. And I also have the CT Blueprint, which is a crash course for the new technologists so that you understand the main points and gets you going on your training. So those things will be available in the link in the show notes. So make sure that you go get it now. This is all the shit that they didn't teach you in your training. I hope these points were super helpful. Make sure you apply it while you're out there on the floor. Also, if you have any questions, you can always email me and I will be happy to answer anything you have. So that is it for this episode, and I will catch you in the next episode.